Hello, everybody,
Hi.
and welcome to another exciting edition of Living
Living
at
at
Your
your
Highest
highest
Quality
quality
of
of life.
Life. Dr. Dan Neides.
Dr. Jessica Hutchins. Hi, everybody.
Great to be with you. Hope everyone had a fantastic Thanksgiving. 216-965-9303 is our phone number. All things functional medicine, medical cannabis, peptides, IVs, sauna, whatever we can do to help you be your best self, let us
And
know.
enjoy the snow day, everybody, in Northeast
In
Ohio.
Cleveland, Ohio, I would imagine if you're in Miami, you're like, wait,
Yeah.
what? What? We had a snow day today? All right, 216-965-9303. I always like to give the number out as a reminder from my mom. She reminds me to say that number a few times. So, hi, Mom. Hope you're enjoying it. Um, so today we wanted to jump in and talk a little bit more peptide, and more specifically, though, looking at it from a side effect perspective. Correct?
Yeah, so, everybody is talking about these weight loss drugs, semaglutide, tirzepatide, which is Ozempic. So semaglutide is Ozempic. That's how most people know it.
Manjaro is.
And yeah, there's a lot of regular pharmaceuticals, and then there's these compounded versions that we've been using. And there are side effects. I mean, there's side effects anytime you have rapid weight loss. And a lot of these are directly linked to the rapid weight loss. So it's not like necessarily the drug specifically is causing the side effect, but the drug's desired effects are almost causing the side effects, if that makes sense. And yeah, you could say, okay, if you have a side effect from a therapy, especially in functional medicine, maybe that's a sign to stop it. But the reality is, people really love these peptides. They love them. And so if they're going to be on them anyway, because you can just get them online, I think, from other countries all over the place, and do it like in a, I think, less safe manner. But anyway, if you're going to be on them, let's try to really optimize how they can benefit your body with like zero side effects. I think we should tolerate zero side effects from these things because there's so much information now about how to prevent them. So that's kind of what I was going to talk about specifically today, is how to prevent some of the common side effects from things like semaglutide and tirzepatide.
And again, just to, kind of remind you where the benefits lie with the semaglutide, tirzepatides.
While you're doing that, I'm going to get these little supplements that I brought out.
They were designed to help people with diabetes and pre-diabetes. So certainly will help patients who have hemoglobin A1Cs that are 5.7 to 6.4 range, which is pre-diabetes. Greater than 6.4 is diagnostic for diabetes. So they've been incredibly helpful at bringing these A1Cs to more normal levels, and it's been incredible to watch people who had struggled at an A1C of 10, 11, 12 being able to come down into the 6.5, 7 range, and for a diabetic, that's incredible. The other area where we really see the benefit is patients who have high systemic inflammation. So we talked for years about how inflammation is a key driver of chronic disease, and we use markers like C-reactive protein as a tool to help us identify people with systemic inflammation. And Dr. Hutchins and I, both have had patient experiences where we have these high CRPs of like 6, 7, 8 range. We do lots of testing to try to figure out, is it metals, is it mold, is it food, is it gut, et cetera, et cetera. And despite the fact that we're able to really help, if it's a mold issue or a metal issue or a gut issue, the CRP for some reason is still higher than 1. And so the peptides have been an amazing bridge as a potent anti-inflammatory. And I think that's really where the sweet spot is, to be honest with you. Yes, people appreciate it because it's a weight loss drug. We're really not focusing on that aspect of it. We're really looking at it as a tool in the toolbox to help patients who are pre-diabetic, diabetic, or have high systemic inflammation. I think that's really been where our focus is.
And people feel great on it in general.
Great. It's
our
really
experience.
Been quite impressive in terms of the response. So we're very excited to share that with you. And again, we want to talk about how do you mitigate some of the potential side effects. I feel that our side effect profile with these peptides has been less than the population at large, because the population at large, they're starting at doses that I perceive to be too high. So when you're doing it through a compounded pharmacy, we start much lower doses and titrate up. And I think from a tolerability standpoint, that has been an absolute home run.
Yeah, for sure. I mean, I don't even know if we've ever had more serious side effects, honestly, in our patient population at all.
Right.
But some of the side effects that are not necessarily serious, but people don't like them. So we're going to talk about that. First, I think we've talked about GI side effects before, but I just want to touch on that because those I think are the most common by far.
Yep.
So nausea, constipation, with heartburn, stuff like that. Sometimes gallbladder issues, which I don't think we have seen any gallbladder issues,
Nope.
knock on wood. So it's the lack of motility. It slows down your gut motility. So some of the things that you can do easily, and we recommend that when people start these GLP-1 peptides that they think about taking some of these. So there's Modal Pro, and these are just some of the brands that I know. Obviously, there's millions of other brands out there. Modal Pro by Pure Encapsulations. There's Motility Assist by Biocidin. And then this Liver GB Plus that was specifically formulated to help support the GLP-1 therapy to minimize side effects with the gallbladder, bile, etc. So any of those are great for the motility aspect. Just make sure you are not constipated and make sure you drink a ton of water. So that's kind of a quick summary of the GI side effects. They can get serious pretty quickly, so just be really mindful. Like even if you're okay with pooping once a week, you shouldn't be okay with pooping once a week. So
Right.
do not start a GLP-1 if you're pooping once a week, please. So the other side effects that are a little bit more cosmetic, but they could potentially have some serious, long-term effects. So muscle loss in general, hair loss, and then losing like the fat and the collagen in your face. And I guess there's a term now called ozempic face, where you just look really aged even though you're losing weight because you're losing all that fat padding that used to kind of almost prevent see these lines right here that I wouldn't have if I was 20 years old. So something like that would be more pronounced. And that is pretty common. So the facial features start happening anywhere between like 4 to 6 months usually. Hair loss is a big one. It's probably more cosmetic than anything else. That hair loss can start a little bit earlier, like 3 to 4 months. And then muscle wasting in general can start within a couple months of starting these. So with muscle wasting, and we do a pretty good job, our nurse does counseling everybody about this, but you need to eat plenty of protein, like between like 90 and 100 grams, somewhere around then, which seems like a lot if you kind of add up the amount of protein, but you're gonna have muscle wasting and muscle loss that's way more than even your fat loss pounds if you don't eat enough protein. You need that protein to keep the muscle building. So that's just absolutely 100% you have to do it. So for people who are vegan, let's say, it's gonna be a lot harder. You can't eat a bunch of cheese and meat, but you could do a protein powder. So protein shakes are obviously processed food, but for this purpose, it's a great way to get all of the protein in because you're going to have a decreased appetite because that's the nature of the GLP-1 therapy, right? So you're not going to want to eat a steak for every meal. You're just not. So the protein powder for this purpose, I think the benefits definitely outweigh any risks of it being a processed food. I don't know if you'd agree with that or not. But there's pea protein, there's plenty of vegan proteins out there, there's non-vegan proteins, so definitely protein shake at some point during the day, if not a couple. The other things specifically for the facial features, so collagen, also for the muscle loss too. But you want a significant amount of collagen, so I brought out a couple different kinds of collagens that a lot of our patients and us personally are using. So Collagen Fit, this is a good collagen by Thorne that has nicotinamide riboside in it, so it gives you a little energy boost as well, and that's just a mitochondrial support. And then there's this one that's Collagen Plus. The big difference is here, this is flavored, which is great if you just want to have it plain, but if you're mixing it with something, I would recommend this other one that's not flavored. I've had them both, and I definitely like the unflavored one a little bit better.
So you got
That's it, just the fiber back there, yeah. So the other thing besides the collagen is vitamin C. So vitamin C you need to rebuild the collagen too. So people recommend like 1 gram of vitamin C a day. And so that's an easy thing that you can mix with a smoothie or a protein drink. You just get a big powdered thing of vitamin C, or you can take capsules, either way. But between the collagen and the vitamin C, getting it in is very important. And with collagen, at least the unflavored collagen, you could even put it in your coffee. So, if you're not eating and you're just drinking coffee in the morning, you can still get a good source of that protein that way. And then with the hair loss specifically, zinc, biotin, omega-3s are really important. Sleeping really well is really important, and not being stressed is really important. So stress absolutely changes the hair follicle cycle routine for sure. And so it's really the stress inside your body of the rapid weight loss that usually causes the hair loss. So whether it's external stress or internal stress, stress definitely still causes it.
I notice your hair seems a little more voluptuous. Are you less stressed?
I actually am less stressed.
Wow.
You know what? Your hair seems a little more voluptuous too. Yeah. No, honestly, my hair has grown a ton in probably the last year.
Wow, just looking at it on the screen. Whoa.
And it sure could be less stressed.
Nice.
I'm definitely less stressed.
Great.
So the other thing, thank you, you too.
Thank you.
The other thing with the muscle loss in general is you have to do weight-bearing exercise. You have to. If your body is not stimulated to rebuild that muscle, it is not going to rebuild. So you have to do the weight-bearing exercise every day if you can. If not every day, maybe 5 days a week. But that is so important. And then so the other big thing that I want to talk about that deals with actually all three of these things, so the muscle wasting, the ozempic face, and the hair loss, is another peptide. And it's called GHKCU.
Should I go
so
get it?
Yeah, go get it. It's a copper peptide. It's kind of a cool blue-looking color. And so I think we told you a couple Facebook Lives ago that we're really researching the heck out of all these peptides. We've been asked and begged from patients for probably 5 or more years now to get on board with the new peptide therapies, and they really are amazing. I mean, there's not all of them, and not all of them for every condition, obviously, but it's just something that's just a natural product, something in your body. And the word peptide just means a couple amino acids put together. But look at this cool color.
Woo!
Look at that. That's the copper color.
Yeah.
And so you take this every day, preferably when you start something like semaglutide or tirzepatide. Put it on the white so they can see the.
Do you have a...
Like here, just right here. See how blue that is? So cool. Anyway,
I'm going to put
here,
it back.
put it back. Keep it refrigerated. So you take that every day, and you don't even need days off. And it can take a couple months at least, if not over 6 months, to kind of help reverse damage that's already done. So by far the easiest thing to do is prevent the damage from happening. So you could always start it the same time you're starting the semaglutide peptide. And it is daily. The semaglutide is weekly, so it's a little bit easier to take, but this copper peptide is daily. But literally, it works for all three things. So the ozempic face, where there's massive face loss and collagen structure loss in the face, the regular muscle loss in the body, and then the hair loss. And the hair loss, so many people have hair loss lately. It's really, really, really common. And so we're going to start using this peptide a lot for hair loss of any source,
Right here.
but specifically.
Like it'll help
Are you
us?
going to try it? Do you think you hate needles? So I don't know if you're going to try
Is this going
it.
to help? I'm going to get that back? Maybe.
Maybe.
Can
Maybe
you
you'll
just
have
rub
like
it
a
in?
full beard.
Yeah.
Oh, that reminds me. Another thing for hair loss that I forgot with all the vitamins I mentioned, scalp massage.
Ah! Scalp massage.
Like
There we
almost
go.
every day,
Okay.
do a scalp massage.
Should I just rub that blue fluid in? No.
Yeah, you can use topical copper peptides, but no, that's not what I was talking about. Like when you're washing your hair,
Really has
massage.
to be a shot, huh? Okay. Just kidding.
Tiny little
Tiny.
injection. It's like a insulin needle, so
Tiny.
it's just the tiniest
It's
little
good.
needle.
I'm good.
If you don't see it, you'll be okay.
I'm good.
I can come up from behind. Anyway, so that's pretty much the brunt of it. The other thing I wanted to show you is a really awesome fiber powder supplement that
I got it. You keep talking.
has been specifically formulated for people on these GLP-1 peptides. So a lot of things are coming out to really optimize the benefits and decrease the risks of these things because they really are helping people. So, you end up taking like 50 million things, but it's all short term. It's a means to an end. And if you lose enough inflammation or, reverse diabetes, which is amazing, then it's all
Then
worth
it's
it for
worth
sure.
it.
For sure.
For sure. Faux show.
So if you're interested at all in talking about any of this stuff, call us. If you're interested in starting any of the peptides, the semaglutide, tirzepatide, or the copper peptide for hair loss, for muscle regrowth. Again, it has multiple purposes, but it is a great one to start at the same time as the semaglutide too. So just call us and we'll get you in.
And we've got other peptides up our sleeve too that can help with
Yeah, we'll
various
do more
disease
Facebook
states.
Lives about those.
So yeah, we're really starting to incorporate this as more of a treatment option for patients who are looking for more than, you know, what traditionally can help in terms of overall body systems flow. And it's really amazing how these peptides, you know, interact with our biology in such positive ways. So really excited.
Right, it's not
continue.
just giving you a protein, it's actually changing gene transcription.
Yeah, it's
in a lot of
amazing.
ways. So
Good
yeah,
stuff.
for sure.
Good stuff. Awesome. Any
All right.
other tidbits? Anything that?
Prevention's always easier than fixing things afterwards, so just remember that. And inflammation is the basis of all chronic diseases. So if we can really get that inflammation down, and obviously these things are much better for people who are doing all the right things. Like we're not going to take somebody who calls and, you know, brings in their McDonald's breakfast with their Coca-Cola and say, oh yeah, you're a perfect candidate for this. No, you need to be doing all the right things too. That's kind of a non-negotiable thing. So this is not a substitute for lifestyle changes at all. This is for the people who have resistant inflammation, resistant blood sugar issues, things like that from, you know, despite doing all the normal things.
Agreed. That was outstanding. Thank you. So if we can help you with peptides, the side effects of peptides, and any other aspect of functional medicine, please let us know. 216-965-9303. Remember, it's your time to thrive.
Let us inspire you.
You guys have a great rest of the week.
Stay warm.
Stay warm for those in Northeast Ohio, and we will see you next time.
All right, bye guys.
Love you guys.